According to the Russian Ministry of Health, over 12% of women in the country regularly abuse alcohol, which raises alarm in the healthcare system. In regions of Siberia and the Far East, the share of women drinking more often than men reaches 20 to 25%, creating local epidemics. Statistics indicate that every third Russian woman admits she experiences a binge at least once a year, which shows the scale of the phenomenon in everyday life. The average life expectancy of women in regions with the highest alcohol consumption has shortened by 5 to 7 years, which affects the entire local community. In many studies, women report drinking more frequently than men, although their daily doses are often lower, which alters the character of the addiction. Analyses show that vodka consumption by women from 2015 to 2025 increased overall by more than 15%. Women are more likely to reach for fruit wines, liqueurs, and beers, which are easier to obtain and cost less than imported luxury spirits. As much as 40% of patients in addiction treatment centers are women, forcing facilities to reflect on specialized therapy programs. In industrial cities, the proportion of women with alcohol problems often exceeds that of men, which affects the structure of local families and care arrangements. The highest rates of female drinking are observed in cities such as Chelyabinsk, Perm, Tomsk, and Irkutsk, where socioeconomic problems accumulate. Loneliness and lack of life prospects are one of the main reasons women fall into chronic drinking, because isolation amplifies despair. Many women begin to turn to alcohol in response to domestic violence and toxic relationships, treating the drink as a short-term escape from suffering. Alcohol is often perceived as a remedy for depression, providing temporary numbness instead of real psychological and therapeutic help. Women drink to drown out poverty and financial instability because costly care and lack of prospects push them to seek immediate relief. Some women start with symbolic celebrations with colleagues at work, where drinking in workplaces remains an ingrained norm. Alcohol also becomes a way to alleviate chronic physical pain when access to medical care is limited and costly for families. Low vodka prices compared with other beverages and the lack of alternatives mean that economic calculation encourages the choice of the cheap spirit. Social pressure, invitations to toasts and banquets make refusal difficult, especially when there are no alternative forms of social integration. Women imitate male drinking patterns, but their frequency of turning to alcohol often surpasses male habits in a given community. Women drink more often in small portions, systematically over many days, which creates a specific binge profile different from male patterns. Binges can last from several to a dozen days, often without external intervention, which increases the risk of serious health complications. Many women reach for alcohol in the evenings after work, hiding the problem from their families and maintaining a false impression of control over their lives. Common practices include hiding bottles in handbags or kitchen cupboards, which testifies to shame and fear of social judgment. Women drink not only at home but also in workplaces, undermining job security and professional relationships in the environment. Sometimes drinking occurs already in the morning before leaving for work, when the routine of addiction begins to control the day and disrupt daily functioning. Alcohol is sometimes diluted with tea or juice to hide the smell, which is an expression of concealing the addiction from relatives and colleagues. Female binges more often have a quiet, covert character, less spectacular but equally destructive as the public manifestations of male drinking sprees. The effects of female binges include more frequent suicidal thoughts and self-destructive actions, as confirmed by clinicians dealing with emotional crises. A binge in women often ends in hospitalization because they reach addiction wards in an advanced state sooner than men. Female alcoholics more often than men lose the right to care for their children, which has long-term consequences for family bonds and the fate of offspring. Drunk mothers often appear in child protection courts where decisions about child custody are made in conditions of extreme family crisis. In many homes, it is women who initiate drinking in the family, which changes domestic rituals and translates into children's habits from an early age. Neighbors often denounce women who drink when their behavior disturbs the peace, which leads to social tensions and local ostracism. Female drinking can ruin the reputation of entire families in the community, and the stigma is sometimes inherited by subsequent generations. As a result of addiction, women are more likely than men to lose their jobs because they are more vulnerable to discrimination and lack of social care. Many addicted women end up in homeless shelters when loss of housing and family support leaves them with no alternative. In small towns, there are so-called women's drinking clubs, gatherings around a table full of vodka that constitute a form of social addiction. Alcohol in binge environments exacerbates violence against women because drinking weakens defense mechanisms and increases exposure to risk. Women develop cirrhosis of the liver more quickly because their bodies metabolize alcohol differently, which leads to accelerated organ damage. Specialists warn that the female body tolerates alcohol binges worse, and the health consequences are often more severe and less reversible. Women affected by addiction more often die before the age of 55, which epidemiological studies in high-consumption regions confirm. Binges are the cause of numerous accidents, fires, and poisonings that additionally burden emergency services and the household budgets of affected families. Hospitals lack programs dedicated to women's alcohol problems, which limits the effectiveness of therapy and rehabilitation for female patients. Treatment in private clinics is unavailable to many women because the cost of therapy often exceeds 100,000 rubles and is not realistic for families. Most women return to drinking after short detoxes because the lack of long-term support and social networks facilitates relapses. The media in Russia rarely address the topic of female alcoholism because the phenomenon remains taboo and little visible in public debate. Female binge drinking is a hidden tragedy of society, showing despair, lack of prospects, and a deficit of care that destroys the daily lives of families.